Hello and welcome to yet another episode of Beauty Investigates. I am the delectable Debbie Arnold, and who are you?
You're a copycat, that's all I can say. I'm the lovely Debbie McGee.
Of course. Today, our beauty investigators, Dee and Natalie, are going to be talking to us about the future of makeup. Doo-doo-doo.
Well, I mean, I actually find this quite fascinating because I know quite a lot about the history of makeup.
Do you?
And going back to the ancient Egyptians that used charcoal and all those thick lines the women had, but the men wore makeup too.
I like men in makeup.
And yeah, actually sometimes it looks good,
yeah,
doesn't it?
you know, like Johnny,
especially if they're
Johnny
ugly.
Depp. Well, no, it's the black eyes and it's the something.
Yeah.
No,
anyway,
it's men in makeup.
She's digressing.
Yes.
But first,
Yes.
we've got a facial plastic surgeon with us.
Yes, Natasha.
Yes, Berridge.
And she is so beautiful herself.
Yeah.
Natasha,
Compliment for you both.
what made you want to do this?
I don't come from a traditional family. My parents aren't surgeons, they're not doctors, and in fact, I spent a lot of time at ballet school as well. I went to stage school. But my trajectory changed when I was in secondary school, and I had a massive love for science. In particular, I absolutely adored biology. So I'm trained as a maxillofacial surgeon, so I'm dually qualified in dentistry and medicine, but my subspeciality interest is indeed facial plastic surgery.
Oh, so the dentistry is interesting, isn't it? So, well, obviously it makes sense because your face is, you know, it's bones and teeth.
Absolutely.
And so it's how you look at somebody.
Yes.
But so you're doing FaceTite at the moment?
So I'm very excited by FaceTite. I think it's been an absolute game changer, particularly in my clinical practice. So I not only perform facial surgical procedures, both for rejuvenation and for disease, but I also perform non-surgical procedures. So that's injectables, Botox, fillers, skin treatments. And where FaceTite has been a game changer, it's really been a game changer for those patients that are not quite ready for surgery, or in fact don't want to have surgery, or maybe don't need to have surgery, but also for the younger patient as well. So FaceTite, known scientifically as radiofrequency assisted liposuction, uses radiofrequency energy, which is heat, that allows one to perform liposuction. So it heats the fat, it dissolves the fat, but the added advantage compared to traditional liposuction is that you also get a skin tightening effect as well. I use it most commonly in the lower part of the face, so I use it in the jawline, the chin and the lateral neck region, and it's a great treatment. It's a minimally invasive treatment, so there are no scars. There's a little port, it's like a wand, like a magician's wand, that is inserted, a little stab incision just below the ear here, a little stab incision just beneath the ear there, and a little stab incision just beneath the chin. And that's inserted into the subdermal plane, into the fat. And what happens is this radiofrequency energy delivers heat from the inside up towards the skin, that stimulates that tightening process. And it's not just about the skin tightening, because what the process also does is stimulates collagen. We all know that collagen's buzzword, and that collagen stimulation really starts getting started and progresses for about 3 to 6 months, up to 12 months, we know that the scientific papers tell us, after having that treatment. So it really is a game changer in my practice for my patients. And I've been getting some really lovely results with it.
Mary Pickford, Greta Garbo, Joan Crawford, Marilyn Monroe, and Rita Hayworth. What do they all have in common? Well, they shared a makeup artist. He created all their looks, and his name was Maximilian Faktorovich, or as we know him, Max Factor. I'm ready for my close-up, Mr. DeMille.
So you're using Immode, which is purported to be the best in the world for this treatment. Can it work on somebody that's not necessarily fat? I'm thinking of myself here.
Yourself?
But I have got little bits of little jowly bits coming.
Yeah. I think that's a really good question, Debbie.
Yeah.
And jowling being part of the ageing process, we all know that when we age, it's not just in the skin, but ageing actually affects the skin, the fat, the ligaments, the underlying craniofacial skeleton starts to get a lot smaller.
The rapidly shrinking heads.
Absolutely, everything shrinks and sags.
You can get even smaller.
Yeah.
Not at all, but for the mild to moderate case, FaceTite's a very good treatment. But it's not a treatment for everybody.
Coming to somebody like you, I know that you would check my medical history and advise whether I should go ahead with something.
Yeah, well, the irony is that your doctors are registered, that they have to be.
Yeah,
you know,
absolutely.
they are accountable.
Absolutely.
But the beauticians aren't.
No.
You're quite right. As a doctor, as a GMC certified maxillofacial surgeon with a specialist interest in facial plastic surgery, I'm heavily regulated.
And as my mother used to say, always remember, cheap is dear. Thank you.
Yeah, great.
Thank you for having me. It's been a delight to be here.
So, Debbie, now we're going to find out what's happening with our beauty investigators, Natalie and Dee.
Well, today we're going to be talking about horrible, nasty, gross makeup practices. Things we wouldn't dream of ever doing again.
I bet you still do them though, don't you?
Like what?
Do you sleep in your makeup?
Oh, me? Never.
You blimming well do.
Well, I did last week.
I thought so.
Does that count?
Yes. Doesn't it make you feel kind of gritty-eyed and icky in the morning?
Yeah, but the thing is, it's usually when I've had a couple of little glasses of something, you see.
Oh, what would
and I
that
get
be?
back and I think, oh, I can't be bothered.
I always take it off, it doesn't matter.
Really?
What time? Yeah.
You're such a goody-goody.
No, I don't think I am. I think it makes my eyes go all gritty the next morning if I don't. Bits of old eyelash still stuck in it and revolting.
Do you ever do anything sort of gross and not, or have you ever in the past?
Never.
Oh,
Look at me. I'm just pure as
Oh,
the
I
driven
know.
snow. Yeah, absolutely. Very, very posh. I don't do things like that.
no, you're very posh.
Do you remember we used to, in the 70s, 80s, maybe even the 90s, we used to share makeup?
Yes,
We were always passing lipsticks around. Ooh.
and eye makeup and all sorts.
I remember being on the bus going to school, and do you remember you used to get those little cake, sort of turquoise-coloured Max Factor
And I know what you're going to
mascara?
say.
Yeah,
I know what you're
you
going
had
to
to
say.
add water, except you didn't add water. All the girls would be sitting there spitting into it and putting their mascara on the way to school, and then lend it to their friends.
Yes, who'd also spit in it.
Ew.
Oh,
But
goodness me.
hairspray.
We used to
teased.
cake it on like.
In the past, makeup was now everything's very sort of translucent
Yes.
and dewy, and,
Yeah.
and that sort of natural look is around, which is so much
That's
nicer
very
than
much-
that thick, caked, pancake makeup that everybody used to wear.
Leichner.
Oh yeah, well actors used to wear the
Leichner.
Leichner. That was like wax,
That
wasn't
was
it? Revolting.
really, I know, and I loved that deep browny colour. And I used to wear it out because I used to think it looked so fabulous.
What did you look like?
I looked like a very, very sort of overly suntanned.
I think we would have got on, don't you? The 1970s, 80s.
Definitely, yeah.
Now it's time to talk sexual rejuvenation with one of Harley Street's finest, Dr. Wakil.
It's great to be here. Okay, today we're going to talk about the O-shot, one of the biggest treatment that we use in vaginal rejuvenation, and I was very privileged to introduce it to Europe and the UK about 14 years ago. What is the O-shot? It's very simple. Injecting platelet-rich plasma into the intimate area, into the vaginal tissue. We inject it into the clitoris, we inject it into the G-spot and the whole anterior vaginal wall. So what does the platelet-rich plasma do? It's very simple. Let's say we cut our hands. When you cut your hand, the first ampullus that come in the area is the platelet. They open up, release something called growth factors, and the growth factor starts regenerating this tissue. And this is how every tissue in your body is repaired, by the way. So what we do, we trick the body. We make it feel that there's an injury in the clitoris, there's an injury in the G-spot and the anterior vaginal wall. So they start regenerating the tissue. By regenerating the tissue, regenerating the blood vessels, and eventually regenerating the nerve endings, we get more sensitivity in the area, more blood flow in the area, and more life in the area. And this is how I restore sensitivity.
Dr. Vincent Wong. He is possibly one of the most beautiful men I've ever seen in my entire life.
Oh, thank you.
And I love your clothes. And I want them. Now, take them off.
I can't naked.
That would be good, wouldn't it?
I'm not sure about that.
Now, Vincent,
Yeah.
it's my chest.
Okay.
I mean, my face has never got really wrinkly, but my chest.
Yeah.
And then I remembered that my grandma had exactly the same chest.
Okay.
So that's obviously hereditary.
Mm-hmm. Yeah, there is definitely a genetic component to that.
Yeah.
Yes.
So after it's got wrinkly, is that the end? Can you not?
No, there are certain things that we can do to reverse any kind of damage. So damage to skin in this area normally comes from sun exposure. But obviously, as you correctly mentioned, there's also genetic factors and also any kind of inflammation underneath the skin that can be down to smoking, drinking, lifestyle, and also pollution. Looking at the area on your chest, the skin is a little bit thin.
Yeah.
So that is a normal aging process. So our skin does get thinner as we age. So there's certain things that we can do to improve the thickness of it. So things like radio frequency with microneedling, for example, will be a good treatment for the chest area. And then we could also look at doing some skin boosters treatment. So these are similar to what we do in the face. So things like polylactic acid, polycaprolactone, calcium hydroxyapatite. There's so many different ways to stimulate the fibroblast production and also the activity of this fibroblast. And finally, we can also use something called exosomes. Have you heard of exosomes before?
No, they sound exciting.
Okay, so exosomes is part of regenerative medicine. So basically, it behaves almost like a stem cell treatment.
Oh, brilliant.
Yeah, so these little messengers, so to speak, will tell the cells to behave in a younger way. All right.
Get to You've got to go out to play now.
You may use the right language for that.
Salmon sperm.
Yes.
Tell us about salmon.
So salmon sperm is what we call polynucleotides. Okay. So it's
How did they find out? That's what I want to know. Who said, "Oh, I think a salmon sperm might work on my face"? I mean, who did that?
So it is the genetic material.
Yeah.
Because salmon genetic material is actually around 96-98% similar to human. Yeah, so that's why it can be used.
So then I could be called fish face.
You'll be a mermaid. Yeah.
And the other thing is, how long does it last?
So once we have achieved the ideal outcome that we want, normally it's just a maintenance once a year.
So it's worth doing.
Absolutely. Yes.
Yeah.
Yes. Yeah.
And does it work on the neck as well, or just it's everywhere?
Everywhere.
Yeah.
Yes.
So in the end, you make an investment.
Exactly.
That's what it is for your chest, which
Yes.
is one of the places that I think looks really old.
Absolutely. And once we've done the treatment, obviously there are certain things that you can do at home to protect it better, to enhance the results a little bit more, and to ensure that it lasts a little bit longer as well.
Yeah.
So things like moisturizing the area, for example, is important. Protect it from the sun is important. Making certain lifestyle habits, if that's appropriate, will be important as well.
Yeah.
We found a girl that actually trains everybody to give facials, so she knows everything there is to know about facials, and Debbie knows who it is.
Yes. Because Debbie didn't. This is Holly Simpson from our Skin Academy, and she is going to tell us all her tricks.
So when you have a client, and you were saying sort of about a 6-month period,
Yeah.
would they be having a treatment every month?
If you're beginning a program with someone and you wanted to turn back time, say, or, you know, make the skin look younger, I actually like to see my clients probably in the beginning once a week. So maybe do a few treatments weekly and then go on to the monthly maintenance. But again, it would depend. I'd be looking at someone's budget. I'd be looking at their time budget, their financial budget, and then actually collaborating all the information and then saying, okay, what can I deliver with this budget, with this time scale for this client? So it's real customised approach, because I believe everyone should be treated individually, because skin is so
But
different.
as you get older, as you know, I mean, because your bones get smaller, your skull gets smaller. So how do you kind of stop that, you know, from appearing? Because that's why we get wrinkles, because our skull is smaller.
Yeah, so yeah, that is something that happens. Obviously, your skull changes. Not that much you can do with that, apart from having good diet.
Yeah.
We again, that's part of the course that I teach. I had a great nutritionist who wrote part of the program. Dale Pinnock, he calls himself the medical chef.
Yes.
So he's actually wrote the, one of the modules, the nutritional module for that. So so obviously there's diet, which is a big part of great skin, as you probably know, but also working on the bed of muscles are really important to keep the muscles firm and stopping that wastage that happens with age. So we want to be, you know, again, diet, but using microcurrent devices, Fradic, face yoga, all of these things to keep the structure really nice and firm and healthy, and of course protecting your fat pads, which again is great for that volume.
It's so interesting how treatments, I mean, from the past, if you like, years and years ago, how facials have changed and, you know, from moved from, you know, what they were with the tight face masks and all these weird things to technology. I think it's really, really fascinating how it works. Just one quick question. And it's about hands. Do you do hand treatments? I know you're a facial academy, but do you do treatments on the hands as well?
Yeah, I mean, you can do pretty much any treatments that you do on the face on the hands, because it is something that gets equally amount of sun exposure as the face. So you do tend to age more on your face, chest and hands because of the exposure to the sun. Yeah.
So you can have the treatments on all of those.
Yeah,
well, absolutely. Brilliant, Holly.
How many times have you done your hair and makeup, put a jumper over your head and your hair's all messed up? So my tip is what my grandmother gave me, and it still works. Get a head square scarf, put it over your hair, pull the jumper down and your hair won't be touched. I promise you, that's my trick. Not a magic one though.
And thank you for watching Beauty Investigates.
Yes, and just a word from me. Everything has beauty, but not everyone sees it. I think that's what Confucius said, or something like that. Anyway, that is my beauty quote of the day. I think I better go and have a drink. Don't you?
Water.
Yeah, water. Water. Water?